and we created our first domestic violence program.
Tenemos dos círculos. Uno dice igualdad.
And on it went.
Raise your hands, remember?
They launched a series of after-school programs for kids. They started classes for moms who wanted to learn how to shop smarter and eat better.
It's 3 servings.
They taught a class on healthy weight so the kids won't become obese, an affliction that strikes 1 in 3 Latino kids in Santa Ana.
2 pounds off, that's good, Antonio.
What I want our community to know is that nobody is going to do this for us. There is a proof to that. You know, there is a proof to the fact that nobody is going to bring a diabetes program to our neighborhood. And the proof is that it took for us to do it, to have one. In this promotores world, you don't recruit the brain. You recruit the heart, because you can train the brain, but you cannot train the heart. So here we are talking about the clusters of skills for the promotor.
Bracho knew about promotoras from her experience in her native Venezuela as a young doctor in the late 1970s.
I practiced in a little town in rural Venezuela. Very, very poor. And I just was a rural physician. When I met these community workers in that town, they had all the kids immunized. And I remember asking them, how do you keep track of this? And they showed me a shoe rack. And in the shoe rack, they had pieces of cardboard with the names of all the kids in town. And they will go, and they show me, they will go house by house. And these promotores will push and push and push to get people to respond and to be with all the immunizations updated. 100% of the kids were immunized. There is something about being resourceful. There is something that is in the capacity of the community that you cannot compare with computers and technology.
Bracho came to the U.S. to get her master's in public health at the University of Michigan. And in 1988, she took a job there, helping to fight the AIDS and crack epidemics that were ravaging inner-city Detroit.
And again there, we just did it with community workers. And we hired people with AIDS. And we hired addicts. And in the same model, the peers, the people that can hear them and can reach them, the people that are not afraid to go in the crack house because they have been an addict, and the people going to reach the sex workers in those streets, we're not afraid of reaching them. But not only we're not afraid, they actually love them. You know, when you recruit this sex worker that is infected and now she becomes a community worker and she's reaching other women, there is some level of love and solidarity. They are not just serving them to have a salary. They are serving them because they have been there, done that, and now understand that they want these women to have a chance in life.
Irma Rivera is one of Bracho's newest promotoras. She first came to Latino Health Access to learn how to manage her own diabetes, and she's been improving her health through exercise and nutrition ever since. Now she's on staff, teaching others.
When we come here, we come with that goal, to teach them how to eat healthier, more nutritiously, in order to avoid obesity and diabetes for the kids in the future. Because right now, there are a lot of things they're eating that, unfortunately, the moms don't know or are unaware that are bad for their health. So that's our goal, to show them that point of view.
Rivera's work with Bracho taught her that living a healthy life is even harder when you live in an unhealthy neighborhood. She says, for example, just look at the signs all over the apartment complexes in town.
In the apartments where a lot of us live, you're not allowed to run, you're not allowed to play, you're not allowed to skate, to ride a bike, to play ball. We're not allowed to do anything. Just be in the room we're renting, locked up and grabbing the remote to watch more television.
Outside, kids wanting to play encounter chained-up lots that read, "No trespassing." It's stunning, actually, block after block after block of vacant lots sealed off from the community. They're the result of the city's oft-promised, yet never delivered, redevelopment plan. What's left is an urban desert.
It's very dense. It's a very dense city.
To Bracho, the chained-up lots are only the beginning, but they prove a point she often makes. This is a community designed to be sick.
Some people choose not to see the issues, not to confront the problems, not to talk about it. It's really bad.
As evidence, Bracho points out there are more liquor stores in this neighborhood than elsewhere in Santa Ana. She says budget cuts here mean that kids don't get the required physical education classes in school. As for parks, believe it or not, there's less open space per resident in Santa Ana than in New York City. Bracho doesn't think any of this happens by accident.
I have to confess, when I see that vacant lot and many other vacant lots, I see injustice. If we are invisible to the people that allocate money, if we are invisible to the people that have the resources, there's something wrong with that picture. If you can make the decision as a political representative or as the leader of an institution, you can make the decision of putting a park in a place and liquor stores in another place, and you put the liquor stores in my neighborhood and the parks in the other neighborhood, there's something very wrong with that. That's French Park. That's what they call a park, right there to your left. Mira, that triangle. It's like what, like Central Park in New York, more or less? Of course, you know, nobody can be active in this park. Here we are facing an epidemic of obesity, and the people cannot move. I always say, in a park like this, what can they play? Theoretical baseball? They can draw people playing basketball? You know, we want a place where kids can run and play and jump and be kids.
Pues yo viví 9 años en esta zona.
I've lived in this area for 9 years. Since I didn't have a place to take my children to play, what I would do is, since the school's parking lot is here and there are no cars there in the afternoon, I would always take the kids there in the afternoon to play.
Rivera would have liked for her kids to use the vast school playgrounds around the neighborhood, but they're all locked up after school. So they ended up playing in a parking lot. What she saw there would drive her to action.
2 times, I saw cases in which a child was almost run over by a car in this section of the street. But there was one time when a car did hit a child chasing after a ball. I saw that mom's reaction. She was so scared, so desperate, to the point that she was crying from such a fright from seeing that. Such a big crash. As a mother, I felt horrible. I mean, these things can't happen. Unfortunately, they are happening because we don't have any space.
Irma was one of those moms that we met in a local school when we were teaching classes of diabetes. Here, she's listening to all of this advice that becomes empty if you have a community that is designed to be sick. You know, so I heard that my kids should exercise so they can increase their opportunities of prevention. Where? It's that contradiction that raises your awareness to a point in which Irma said, I don't want to take this anymore. There has to be a way. And Irma approached us and said, can we organize the moms and get a park? And we said, very much at the Latino Health Access style, with your help, we will.
And that's how the campaign for a park began, with Irma Rivera its unofficial leader. She organized other moms, participated in rallies, and hounded city officials. They got the press's attention too, generating coverage in several local papers. When Rivera and others from Bracho's group suggested this lot as a possible site for a park, city officials said no. It's within that proposed redevelopment zone, and the city had other plans for it. But Rivera wouldn't give up.
Este es el edificio de City Hall, en donde yo vine